Hey everybody, so I posted this photo and these videos yesterday from the operating room, and I keep getting asked the question, well, what is this? So this actually right here is a phenomenon known as capsular contracture, also known as encapsulation, okay? So what is that is basically whenever there's a foreign body inside your body, like a breast implant, your body forms a wall around it. That wall is called the capsule. Okay, that capsule is present at 3 weeks. In fact, if I had a normal capsule next to this capsule, it would look like a piece of like tissue paper, very thin, very soft, very pliable. In fact, at 3 weeks, most patients don't even realize they have a capsule. Okay, so what is encapsulation or capsular contracture is when that capsule becomes calcified, so firm like an eggshell. Okay, so if I would roll this video, you would actually see on the inside of it, it's white like calcium. Okay, and these on examination, the patient presented with very firm, rock hard breasts. They were uncomfortable. They looked strange. They felt strange. They were uncomfortable. She couldn't go without a bra. She couldn't hug someone. It was very, very uncomfortable. These implants have been in since the mid 80s, I think. And so what causes this is no one really knows, but the most commonly accepted etiology is that you get a bacterial biofilm on the implants. So not necessarily infected, just colonized. And that your body can't get on there to get rid of these bacteria. And so because it's irritated to the body, it forms this thickened wall around it to protect you. This happens about 1% per year. So in 10 years, your rate's about 10%. And if it does happen, that's typically an indication to change your breast implants out. Typically what you need to do is basically put the implants in a different pocket, like instead of putting them in the same little pocket there where there's already wrapped by this encapsulation, you make a new one, because if there's bacteria already in there, you don't want to seed the new implant with more bacteria. This particular patient actually had recurrent encapsulation. So if you get this one time, the chances of you getting it another time are a little bit higher. And so if this keeps occurring in patients, generally what most practitioners would recommend is to remove the implants entirely and start all over after about 3 months to allow the area to decontaminate. And that's what we're doing for this patient right here. So this again is capsular contracture, also known as encapsulation. Happens 1% per year. Is definitely typically a reason to change out your breast implants.